Hello, and thank you for joining us for the first section of Module 1 of the Housing Certification Program pre-course. For this section, we'll give you a brief introduction of HOPWA and who has HOPWA been able to help over the years. This section in itself is not very long, so if you feel the need to pause throughout the video, please do so if you need to read additional information on the slides, or please feel free to rewind if there's something you didn't hear or weren't able to catch. Throughout the course of the various modules, you'll be hearing to us refer to HOPWA, which stands for the Housing Opportunities for People Living with AIDS. And HOPWA is a nationally recognized program, and it funds housing assistance and supportive services for low-income persons living with HIV or AIDS, as well as their families who are either currently homeless, at risk of homelessness, or unstably housed. And because it is a national program, it is available in all 50 states, the District of Columbia, and the Commonwealth of Puerto Rico. Next, what I want to talk about is why is it that we need housing for people living with HIV or AIDS? And to commemorate the 20 years of HOPWA, the Office of HIV and AIDS actually released HOPWA 20, Housing Innovations in HIV Care. And this publication not only talks about the 6 reasons why we need housing for people living with HIV, but it also highlights a few of the many successful strategies, models, and collaborations that the HOPWA program has developed to increase housing stability and quality and the quality of life for people living with HIV or AIDS. And so HOPWA 20, and this document, you could actually access it. We have it right underneath the video. And I do encourage all of you to please take the time to read through the issue. It has a lot of great information, and it's information that we'll be covering throughout the various other sections as well. And so the 6 evidence-based reasons for HIV housing are: first is a need. There's a significant need that exists, as people living with HIV or AIDS are significantly more vulnerable to becoming homeless during their lifetime. We also talk about HIV prevention, and to really maximize our HIV prevention efforts, housing is an important component to take into account, because housing stabilization can lead to reduced risk behaviors and transmission for people living with HIV. We also need to support people living with HIV or AIDS achieve improved treatment and health outcomes, right? And we do this by providing and assisting them to achieve housing stabilization. And research has indicated that homeless people living with HIV or AIDS who've been provided HOPWA housing support have demonstrated improved medication adherence and health outcomes. And as a nation, we are trying to reduce HIV transmission and get to 0 new HIV cases. And so in order to do this, we do have to address all needs of people living with HIV. And it's not just about the medication, but it's also addressing housing needs and other supportive services that they may need. Another factor we have to take into account is how do we minimize costs without reducing or affecting the quality of services being delivered to people living with HIV or AIDS. And housing services are one of the many services that support the 5th reason presented in this slide, which is the cost savings aspect of it. Because homeless or unstably housed people living with HIV or AIDS are more frequent users of high-cost hospital-based emergency or inpatient services, shelters, and the criminal justice system. And lastly, we look at discrimination and stigma, as HIV and AIDS-related stigma and discrimination add to barriers and disparities in access, appropriate housing and care, along with adherence to HIV treatment. So discrimination and stigma has been something that's been around since the start of the epidemic, and it's still very much rampant in today's day and age. And as housing specialists, we have to ask ourselves, how can we address the stigma and the discrimination that our clients can potentially face when they are looking for stable housing? And so to wrap this little section up, I just want to reiterate the fact that research has consistently shown that housing is a critical component of HIV care and prevention. And by providing assistance with housing and related services, The HOPWA program helps people living with HIV or AIDS enter into housing, access and remain in care, and adhere to treatment, which results in reduced use of emergency care and hospital services and improved better health outcomes. And so what we're going to do next is take a closer look at the racial and ethnic background of those individuals who are benefiting from HOPWA services. So when we're looking at the racial and ethnic background, this slide demonstrates the diversity of HOPWA beneficiaries and is reflective of this disparate impact of HIV on minorities. As you can see from the slide, 62% of persons receiving HOPWA housing identify as Black or African American or other racial multiracial minorities, whereas nearly 1/5 of households identify as having Hispanic or Latino ethnicities. And over 40% of beneficiaries are female, and almost 1/5 are under the age of 18. Beneficiaries of HOPWA housing assistance access a diverse range of supportive services to meet their varied needs that exist. So it's not just limited to housing. Some of these services might include, but are not limited to, case management, behavioral health, housing information, meals and nutrition, transportation, employment services, and benefits assistance. And so housing specialists need to be well versed on the various services that exist in your respective jurisdiction, so you're better able to help your clients when they do need access to various services and not just housing. And these supportive services, depending on the agency, may be provided on site or by referral. The Centers for Disease Control and Prevention, also known as the CDC, reports that half of all new HIV infected people are under the age of 25. Previous research has found that many young people living with HIV or AIDS often report common histories of homelessness, physical, emotional, or sexual abuse, suicidal ideation, disrupted schooling or lack of basic life skills, parents who are unable or unwilling to care, and difficulties linking to care. Families today also face a myriad of challenges in regards to financial literacy, economic stability, healthcare, access to education, and childcare, which are compounded by their HIV and AIDS-related needs. Adequate housing and services are needed to address the increased health needs facing families and youth at risk of homelessness who are affected by HIV. It's important to know some of the factors that are affecting youth and families and the challenges that they're facing to be better prepared to address their needs and to assist them in the best way possible. Depending on your agency, you may have programs in place that are specific for these populations, or you may have collaborations in place with other agencies who provide support to youth or families who are affected by or living with HIV or AIDS. So to conclude this section, I just want to summarize what the HOPWA program is and what it's been able to achieve. So the HOPWA program is the only federal program dedicated to addressing the housing needs of persons living with HIV or AIDS and their families. HOPWA providers have reported various achievements since its inception. That includes types of housing assistance provided, the number of households served, and measurements of how connected households are to care. The Consolidated Annual Performance and Evaluation reports are reports submitted annually by program grantees that show the program goals are being achieved, households are achieving stability, and homelessness is being prevented, and households are better connected to care. In 2011, HOPWA was able to provide assistance to 60,234 households. 95% of households receiving permanent housing assistance remain stably housed. 96% of households receiving short-term rent, mortgage, or utility assistance were found to be stably housed or demonstrated a reduced risk of homelessness. And 79% of those receiving other short-term or transitional support were also either stably housed or demonstrated a reduced risk of homelessness. So the HOPWA program is really an essential program that has benefited many people living with HIV and has assisted many people living with HIV move through the continuum of care and achieve viral suppression and reduce the risk of transmitting the virus. And we'll talk in more detail about that in the following sections. This concludes Section 1 of Module 1. Before moving on to Section 2, I do want to encourage you to please attempt the activity below. It's meant to just reinforce some of the concepts and some of the things we discussed in this one section, and it will also prepare you to take the assessment. Right below this video, you'll also find the resource that we've been talking about throughout this section, HOPWA 20, Housing Innovations in HIV Care. I do encourage you to take the time to read through this document, and it is also a document that we'll be referencing throughout the course of the various modules as you proceed with the online pre-course. So whenever you're ready, please feel free to move on to Section 2 of Module 1.